I and Flinders NT acknowledge and pay respect to the past, present and future traditional custodians and elders of this nation and the continuation of cultural and spiritual educational practices of Aboriginal and Torres Strait Islander people. In particular, I'd like to pay respects to the peoples of the Larrakia Nation, who are the traditional custodians of the Darwin and Palmerston region, from where myself and Dr. Dev are zooming in from, and the Gadigal nations of the Eora Nations, where Jeanette is zooming from in Sydney, and any other lands that any of our attendees might be joining from. My name's Dr. Olivia O'Donoghue. I'm a GP, medical educator and cultural educator in Darwin. I'm also the medical director for the Flinders NT Regional Training Hub in the Top End. The Regional Training Hub has been set up to help improve postgraduate medical training capacity and pathways for any medical graduates wanting to pursue specialist training in the Northern Territory. So I'm proud to be facilitating this series of medical career pathways webinars, which is a collaboration between Flinders NT, the Regional Training Hub, Top End Health Services, the specialty colleges and respected clinicians from across the health services in the NT. Today, we're joined by the Australasian College of Dermatologists to talk about all the exciting and hands-on careers opportunities that they offer, and in particular, how someone from the NT might want to pursue a career in dermatology and how they can achieve that. So today we're joined by Miss Jeanette Farley, who's the Academic Support Officer from the college, and Dr. Dev Tilakaratne, and he's probably going to correct my pronunciation of that a bit later, who's a fellow of the College of Dermatology and a staff dermatologist at Top End Health Services, and also in some private practice in the Top End region. So I'm going to now stop sharing my screen, and due to some challenges with internet bandwidth for Jeanette Farley, she's managed to pre-record her presentation for us this evening, so we're going to play that first, but then there'll be an opportunity to ask Jeanette questions after her presentation. So thank you. We'll go to that presentation now.
Hi, my name is Jeanette Farley and I am the Academic Support Officer at the Australasian College of Dermatologists. I'll be going through the application and selection process for Australian medical graduates wishing to get onto the training program. The Australasian College of Dermatologists is the only organisation accredited to train and assess dermatologists in Australia. To be eligible for consideration, applicants must meet the following 3 requirements: be registered for medical practice in Australia, have permanent residency status in Australia or permitted to remain in Australia indefinitely, and have completed a minimum of 2 years of postgraduate training by the time they commence the training program. Here is an overview of the training process. You will need to firstly complete a university medical degree registrable in Australia, complete minimum of 2 years post-university medical experience, be selected into the training program, complete the 4-year requirements of the training program, and pass the fellowship exam to be eligible to become a fellow of the ACD. Applications usually open in February for the following year's intake. Applications are completed and submitted online via the college website. The number of positions vary from year to year. This is dependent on funding, fellowship, and trainee leave requests. Usually there are between 18 to 24 offers made nationally each year. Please refer to the college website for the number of offers made over the past years. Applications usually close at the end of April. Applications are assessed on undergraduate academic performance, specialty qualifications, employment history, dermatology interest, publications, presentations and research, community and leadership, and rural background. Note that employment history and interest in dermatology carry a higher weighting over the other categories. Applicants who are shortlisted for an interview are notified in July. Interviews take place in August and consist of 2 interview panels, one addressing CV and medical questions, the other assessing behavioural questions. Applicants will be asked to nominate 6 referees in their application, 2 supervisor referees, 2 medical peer referees, and 2 paramedical referees. Nominated referees must have worked with the applicant within the last 2 years. Note that your referees do not have to be dermatologists. We strongly recommend nominating referees who you have worked closely with, who understands your character and ability. Offers are generally made in September to commence training in the new clinical year. However, note that some offers may be made during the clinical year of the program, while some positions may require an immediate start. Majority of positions start on the first Monday of February. Offers should be accepted knowing that you may be placed in an area involving rural placement or an area that is not close to home. When applying for the training program, applicants will need to nominate which states they would like to train in. Applicants may nominate more than one state. The college currently has 1 training position at the Royal Darwin Hospital. Applicants wishing to train there will need to nominate South Australia as their preferred state of training. Note that trainees cannot nominate which facility they want to train at. It is the Director of Training that allocates the training sites for trainees. Once accepted into the program, trainees may be eligible to apply for recognition of prior learning in several areas of the training program. These include clinical training and education, assessments, and research. Trainees should refer to the RPL policy to ensure they are eligible to apply prior to submitting their application.
That was really interesting and a beautiful short overview of training for the college. So I just wanted to double check. There was lots of application requirements or assessment criteria. Could I just ask again, I didn't quite catch it completely. There was a couple of things that had a higher weighting than the others in terms of when the applications are reviewed. Which things were those, Janet?
So applications are assessed across 5 categories. And so that would be your academic performance, your employment history, your interest in dermatology, community leadership, and research, presentations and publications. We also look at your rural commitment. It's your employment history and your interest in dermatology that does carry a higher weighting over the other categories.
Thank you. And if someone wanted to train in the Northern Territory, they'd be part of the South Australian Training Network, is that correct?
That's correct. So applicants are asked to nominate which state they want to train in. They can nominate all 5 states if that's what they want to be considered for. They do preference their states. So anyone looking to train in the Northern Territory would need to nominate South Australia as their training location.
Okay. It's quite convenient that we're talking about training in the Northern Territory, because I'm sure that Dr. Dev would be the perfect person to express your interest to if you were wanting to pursue a career in dermatology in the Northern Territory and through the SA network. So without further ado, I might introduce Dr. Dev, who's, as I said, a fellow of the Australasian College of Dermatology and a staff dermatologist at Top End Health Services. Thank you, Dev.
Okay, wonderful. Thank you for the introduction. I might just start sharing my screen straight away. There we are. So basically, I've titled this Northern Exposure because this is a bit of a mixed talk. It's almost like two talks in one. There's one part which is my personal experience with dermatology in the Northern Territory, and the other part is around the training process more specifically. So basically, I was born and raised here in Darwin. I did my medical degree at James Cook University, which is an undergraduate degree, and I did my 2 clinical years at what was the Northern Territory Clinical School. That's before the NT medical program. I did an elective in Malta, and that was actually the experience that was transformative for my career, because I was attached to a dermatologist nearing the end of his career. He did not have a registrar or any other trainees at the time. It was approaching summer holidays. I think it was in summer holidays. And so he was basically very passionate about dermatology, had all of this knowledge, and I was essentially a receptacle for that knowledge. And it was his enthusiasm for the specialty was infectious. I largely went there to have a good time on an elective, but I found myself coming in on weekends out of interest to help with theatre lists, and really I was hooked from there. When I returned to Darwin, I realized that we were actually in great need for dermatology here in the NT. We largely had a visiting service at the time, and there were a few other medical specialties that were getting established, but really we didn't have anything by way of a permanent structure for dermatology. And even though my path had largely been carved out for me to enter general practice, I decided to change my pathway based on my recent experiences. So I made a commitment, and really once I made the commitment to start dermatology training, that was really the beginning of the process. So going into dermatology and entering the program isn't really something that can be done half-heartedly, and it's really quite important to make sure that you're very sure that it's what you want to do, and the best way of doing that is to get some form of experience, either as an elective or a selective, or sitting in on clinics, that kind of thing, because it is a specialty that's very different to what you might consider it is based on a GP experience of skin conditions. It's very different in a private practice and a hospital setting. So in order to further my experience and improve my chances in entering the program, I assisted with a research project here at the Menzies School of Health Research, which was a skin sore study. That study went on to get published in The Lancet. It was a huge project of which I was a small part, but it was fantastic for me to see how that kind of large research trials work. I then visited some dermatology departments in public hospitals in Adelaide, knowing that that's the nearest centre in terms of visiting services. So there was some kind of a link between South Australia and the Northern Territory, even at that time, with visiting dermatologists. And I managed to enter the program, and I was fortunate enough to be able to do one of those 4 training years back in a STP funded position that was run out of the Royal Adelaide Hospital, but involved doing 1 week each month in the Northern Territory for a whole year. So I was able to still get some experience up here before I eventually completed training and then returned back here to the Northern Territory. So that was my pathway, and I'll talk a little bit about what activities I've been able to do since returning here. But I guess there's an important concept when it comes to dermatology training, which is exposure. And I touched on that earlier. Basically, there's 2 things. I mean, and maybe in a way, these dot points should be the other way around, but I think they're both relevant. Maybe I'll start with the second point, is from the perspective of someone who's interested, how can you really be sure that that's what you want to do for the rest of your life if you haven't had any personal experience with a dermatologist in a clinical setting? So I think it's one thing to go by how interesting a lecture might be that you might get. Some dermatologists are more charismatic than others, the other thing is that really in it from a clinical perspective, it's a very broad, diverse range of conditions that we see. There are thousands of conditions that we have to know about and be responsible for. Many of these conditions are things you might only see once in your career. And so I think sometimes the actual experience of being a dermatologist and doing dermatology is very different from maybe some things that you might see, say, in the media, where it's all about cosmetics, or in a lot of the advertising in newspapers and things like that, which are more about skin cancers. There is quite a lot to it. So because the entry requirements for the college are strict, and it's a super competitive specialty, you really can't do it half-heartedly. So first thing is you have to be sure it's what you want to do, and then you can really commit to it and further get further experience, improve your CV, that kind of thing. And I guess the other thing is, because of the structure of the way that the training program is from a selection perspective, because you are essentially nominating faculties that you want to join, it is important to get some experience relevant to the faculties that you're planning on applying for. For most people, that is a decision that is essentially made for you, because you'll be applying to the faculty where you're residing. Now, in the Northern Territory, as we just discussed, our position here at Royal Darwin Hospital is nested within the South Australian faculty. So simply getting experience in the Northern Territory may not be enough. I'm hoping that it is enough. I'm hoping that by being here, providing a stable service and providing a lot of services that are analogous to what is being done in South Australia, that the faculties and the selection committees might look at this as being an analogous experience, but I don't know that for sure. And so certainly if going through the South Australian faculty, you might be fortunate enough to do 1 year in the Royal Darwin position, but 3 of those years will have to be done in other South Australian hospitals. So it's very important to understand exactly how the services run there. And so I think some kind of visit would be useful to actually see how the large tertiary centres run their dermatology departments. That was what I did, and I found it very useful. I suppose the other point about that is, if the faculty is responsible for actually looking into your interest, anyone can say that they're interested, but really the faculty's way of verifying that is really seeing you at meetings, seeing work that you have published, and actually getting known to the faculty members, because that is something that basically it can't be argued with. If you've done the work, and if you're repeatedly there at all of the important state and annual meetings, then that really is a demonstrated commitment over time, not just at one point in time. So I don't want to really labor that point, but I do think it is important. Quite often I see people who have maybe what's a fleeting interest, but really I think it is very important to be able to demonstrate that it's a very sustained thing. So looking at dermatology training now in medical school is really the best time, because we are very happy to have people involved coming and sitting in on clinics, assisting with audits and those kind of things, which will really stand you in good stead in a few years' time when you're looking to apply it to the training program. So I mentioned that I did some research. I attended some conferences. I contacted some private dermatologists and sat in with them as well. And I visited the major hospitals. But really, there's no one pathway. Everybody will forge their own way depending on what opportunities are available to them, and how they want to prioritize electives and things like that. This was my experience with the training program, going through a different hospital each year, and that is likely to be everyone's experience when they enter the training program. For me, training was very eye-opening, even after having had some experience. It was really a time when I realized just how diverse the dermatologic conditions are. And it was something that actually took me by surprise. I've got a photo coming up of some textbooks that kind of highlighted just how many conditions there were. In a way, dermatology is not, it's not just, it's not like the other major organ systems where there are a few prototypic conditions and, you know, everything is a variation of, you know, heart failure or electrical conduction, you know, problems. These are really very unique conditions that behave very differently. Here are the pictures. So as you can see, there's you know, there's Rooks here, which is this 4-volume textbook with some 3,000 odd conditions in there that you essentially have to memorize for fellowship exams, and that we use on a clinical basis quite frequently. There's contact dermatitis, the surgical aspect of dermatology, the pharmacologic aspect of dermatology, and a lot of pathology, which we have to understand how to interpret the biopsy reports and excision reports. Training for me was hard work. I remember it being just very, very intensive to try and learn all of this and at the same time provide a clinical service attached to a hospital during the day. I don't know if you can see the clocks in the background of these photos. These are two of the junior registrars who I was working with in my final year of training, but it's almost 5 o'clock and we weren't anywhere near done. So I thought it was, you know, appropriate to, I guess, just highlight the realities of how grueling the actual training process is. Not to kid yourself, but if you love it, then you should go for it. I made a lot of fantastic role models. These are all dermatologists who've basically come through the Northern Territory and done some time here in some capacity. Lachlan Warren on left of screen and Jenny Menz in particular have done visiting services here for the last 10 years or so, and really were very welcoming of my interest in the specialty, and I hope to do the same for others. These were some of the registrars who were who went along with me during my training years. Probably the most important thing to note is, being a small college, there are some 563, I think, dermatologists as of last year. You know, we do know one another quite well. And a lot of the dermatologists in these pictures have supported me in some way or another, either through visiting services up here or simply being a sounding board from a clinical perspective, assisting, making me aware of important clinical meetings taking place interstate and that kind of thing. So I'm obviously very grateful. And we had a lot of fun along the way as well. So what have we done with dermatology here? So things have changed quite a lot since I've come back. We've got a bit of a structure at the hospital with how the clinics are run. So on Mondays, we have an emergency clinic. So this basically saves us being contacted too frequently through the emergency department through the week. So this gives a real chance for the emergency physicians to have a go at treatment. And, you know, if it's not quite right, if it needs to be fine-tuned, we'll see those patients within the week. So it's a great way of consolidating that for them. Wednesdays are general clinics. We have annual skin screening days for transplant recipients. We do ward consults for the whole hospital for skin conditions. Myself and the registrar are involved in teaching for medical students, and as well as interns. We used to have a GP registrar position, which is now has been transformed into an RMO position. So that is something that an opportunity that will be available in the future as well for local RMOs. And now we have an STP registrar. So this is a Commonwealth federally funded position that is split between the hospital and Darwin Dermatology. And it is run as a 12-month term, basically. So we currently have a registrar occupying that for the first time. The good thing about working here in dermatology is that patients are generally very grateful. They're just grateful to have a stable service, grateful for the care that they receive. This is a real place where if you have an interest, you can actually make an impact in terms of Indigenous dermatologic conditions. We do a lot of outreach, and we have a lot of patients coming in to see us in person as well. Furthermore, we're involved in a huge research study, but I'll get into that in a moment. Some of the difficulties is obviously we cover a very large area, so we're providing advice basically across the Northern Territory, and there have been issues with workforce with our surgical colleagues, which does unfortunately impact on us as well. We don't have as yet a dedicated dermatology nursing support. There's no access to a wet wraps from an outpatient perspective, but these are things that we are working on. And unfortunately, we do frequently see people who are just presenting in extremis. So it can be, a very difficult and confronting specialty at times, but also very rewarding. So I established Darwin Dermatology 4 and a bit years ago as a private service, and as I mentioned before, the registrar position actually does also encompass some work in this clinic. We offer, in addition to normal consulting, phototherapy, which is something unique to dermatology, patch testing, once again unique, iontophoresis, anti-sweating treatments, acne scar treatments, so all things that are different from the run-of-the-mill medical experience or medical treatments, and we are visiting services from interstate. Now, I mentioned that we have the opportunity to do research. At present, Darwin Dermatology is the site of a phase 2 study investigating moxidectin as a new treatment for scabies, as a once-only stat treatment, which basically, if this works, we will be bringing it to the world, not just to Darwin or the Northern Territory for scabies. I'm very proud to be able to do that here. And these are the kinds of things that, with a growing dermatology workforce, we will be able to do more of. And hopefully one day we will be a site that is able to kind of stand on its own 2 feet, and have a faculty that's analogous to the other states. But for now, I'm very grateful for the South Australian faculty, and I'm grateful for all of the important links that we have with them. We also do a fair bit of teledermatology up here as well. You can imagine with the amount of distance that we have to cover. So this is a private service that we've set up that is basically not just in the Northern Territory, but nationwide. So at present, we are seeing a lot of patients who, unfortunately, because of the COVID-19 situation, can't see their normal dermatologist interstate, even though they might be very close by. Not everyone is familiar with telehealth, and so this is something where really little old us in the Northern Territory have led the way nationally, and I'm very proud to have done that as well. So you can see there is scope to do all kinds of things within dermatology. It is not just acne, eczema, and psoriasis. As they say, it's a very interesting specialty. We also do outreach around the Northern Territory. Once again, I'm hoping with a growing workforce, this is something that we might be able to see more of, because there are some things that do need to be dealt with in person. And these are some of the visiting registrars who have accompanied me on some trips over the years. I mentioned research. It does not have to be huge studies if you're interested in dermatology. A phase 2 study of a medication is great, but it takes a long time. We see enough interesting things that we're constantly publishing case reports, audits as well. So if you are interested, we're happy to have you in the department in some capacity, or whatever capacity. Just have to reach out to us. And I mentioned that we now have 2 new ways of being involved with dermatology in the Northern Territory. So there is this STP registrar position, which we've already mentioned, but we now also have a 6-month RMO term. Now, RMO terms in dermatology are very hard to come by interstate, so this is one of the few we have in the country. And to have it as a 6-month term is even better for stability and education. It's a rotation that actually carries with it quite a lot of responsibility. During the day, the RMO is actually taking the calls for ward consults and interstate advice, and then discussing with myself and the registrar. So it's a fantastic way to get great experience with a really wide variety of conditions, and really understanding how new treatments like biologics work, and getting hands-on with procedures. So if you are in the Northern Territory and looking to get some experience, that would be something fantastic to apply for. So if you do want to know more, you could also contact the RDH registrar to get some current experience about what it is like. Don't have to just take my word for it. If you're interested in the RMO term, then you can contact the medical admin at the hospital, or email me if you want to arrange some kind of elective, or even just to sit in on some clinics. We're always happy to have anyone who's interested. Thank you.
Thank you, Deb. That was really interesting. I've been a clinician in the Northern Territory for quite some time now, and a GP for the last 8 years. And the history of dermatology services in the Northern Territory has been up and down throughout that whole time. So it's really interesting from my perspective to see how the department is really growing and reaching all across the Northern Territory, and it's really wonderful to have some homegrown dermatology consultants and lots of opportunities for people who are interested in dermatology. So thank you very much for that presentation. I was wondering, you mentioned there's lots of really unique medicine, a broad range of conditions and some things that you might not see very often, and I imagine that's one of the lures of working in the Northern Territory, seeing some really interesting pathology. Do you have any, can you share any gems that you might have come across?
Yeah, sure. I mean, the fascinating thing for me is how the environment interacts with the skin. I think that's something that not a lot of other specialties really have to consider all that much.
Yeah.
So, I mean, we see people who have contact allergies to the dyes in newspaper, and so they open their newspaper first thing in the morning, and it causes a contact dermatitis. So a lot of the time we feel like detectives trying to figure out what is it exactly that this person is coming into contact with. Hand rashes where someone's allergic to the knob of the stick shift, the gear shift in the car. These are things that you don't often think about. It's possible to get contact dermatitis from washing somebody else's clothes. If you're the person who does the washing of clothes in the household, you can actually be allergic to something that someone else in the household has been exposed to. So I think contact dermatitis and how the environment is impacting on the skin is very interesting. Along the same vein, photosensitive disorders are interesting as well. I mean, we always think about the sun as, generally speaking, something that's healthy for us with vitamin D production, that kind of thing. But we know that excess sun can cause skin cancer and contribute to that side of things. But what's interesting is that there is an interplay with the sun that's in between those two extremes, where it can exacerbate other simple conditions like eczema, or there are conditions where people are just primarily sun sensitive and photosensitive and come out with rashes with the sun. So I really like that aspect of it. I mean, the other thing up here, though, that's more specific to the Northern Territory are the number of weird and wonderful infections that we see. So every year I'll get a culture result back from a sample that will be some fungus that I've never heard of, or some rare slow growing organism that we just kind of read about in the textbooks or think about exists overseas, but we do, from a climate perspective, do have the right climate to actually see some of these tropical diseases up here that interstate trainees simply don't get exposure to, interstate dermatologists simply don't see. I think that, but the other thing is that just there are many genetic skin diseases as well that are just distributed, throughout the population in very low numbers, and so we are in a very unique position of actually understanding those, knowing what they are, how to manage them, and so it's very satisfying to have a knowledge set that not many people have to that degree, and to be able to just kind of walk in the room and instantly understand what's going wrong when so many people have been struggling, including the patient, to try and figure it out. It really, it's not very often you feel like a rock star in medicine, but this is certainly, one of those specialties where we get those moments more than most, I think.
Excellent. Your passion for your career vocation is really shining through there.
Well, it is infectious. So.
Definitely. You also mentioned that it's really important to, if you're interested in a career in dermatology, to really invest in getting experience, showing your interest, meeting the right people, visit dermatologists in their clinics and in the hospitals, be involved as much as possible. You mentioned that you can get involved in, assisting with clinical audits and all that sort of stuff really kind of early on in your career, even from the medical student stage. I was wondering, and this is a question for both of you, if there's anything that the college specifically does to engage students, interns, pre-vocational junior doctors, to be able to express their interest or follow their interest for this pathway. Like, are there any programs that are run by the college that can do that?
We don't really have programs, but we do run the annual scientific meetings, so they can always register and attend that, and that is something that they can put on the application. The college is aware that opportunities aren't always available across all states, so certainly they do look at, if you are volunteering and attending clinics or research, papers, presentation, publication. That's why the application looks at a wide variety. It assesses across, a few different things.
Yeah. Okay. Was there anything that you recall from your engagement with the college as either a student or pre-vocational, Dev?
Well, I think as far as structured activities is exactly as you'd mentioned, but I think the other thing is that for me it seems to be, it's more about consistency over time. That's, I don't think, as long as, like, for someone who's interested, as long as you're consistently doing things that demonstrate that interest, it almost doesn't need to be structured. So, I mean, I think that if you're engaged with a department, if you're sitting in regularly on clinics, that if you're only mildly interested in the specialty, you're not going to do that consistently over time. And by sitting in on clinics, or if there's a dermatologist who's happy to sit in on private rooms or things like that, then the case studies and things like that do organically happen, because you see interesting things, or the department is going through some interesting phase where they have a new piece of equipment, or they're trialing a new surgery or something like that. The research opportunities do come. I think one big thing is, I guess, a lot of the time people ask me whether we have research, to be done, if you've got a project or something like that to be written up. I think that's too artificial for me. It should be, if you're going to write something up, it should be something you've been involved in some capacity. And to then be involved in it, once again, you've got to be there. You've got to show up and actually, be present in a department or a unit or a clinic. So I think that research for the sake of research is also pointless. And if the research is being driven by some clinical question that the department is trying to answer or solve, then that's going to be meaningful. And also it's going to be something that's likely to be publishable, because if one department is needing to look at it, there's a good chance that the other departments are also having similar issues.
I guess you always want research that's going to have a bit of an outcomes focus and be able to inform on ways of managing treatments and informing care for patients and stuff as well. or coming up with really new clinical treatments that can be used worldwide, as it sounds like some of the projects that are being led in Darwin might do, and have done by the sounds of it. I'm hearing that if anyone who's a student or an intern or other pre-vocational doctor in the Territory who's interested in dermatology as a career should start expressing their interest now, get in contact with yourself, Dev, and the department and the hospital, investigate what the options are for getting involved, and having a bit of that preceptor mentorship going on now so that they can improve their experience level and exposure to the discipline for their potential applications to the college. So I hope that's okay. We'll just send everybody your way, Deb.
Happy to have it. Happy to have anyone.
Of course, if they're then getting to the application stage, engage with Jeanette and her team at the college. Just wondering if either of you could quickly run us through what some of the assessment requirements are during training. Like, what sorts of things do you need to have done before you complete training and become a fellow?
Now, I mean, I can talk with how things were when I went through about 5 years ago now, which, and maybe then, Janet, maybe if you want to modify that if that's needed. So, I mean, largely the requirements are, so there is the medical dermatology side of it. The examinations do assess from a written perspective medical knowledge. There's also a practical, almost like a Viva style of exam at the end of fellowship, which is also looking at the medical side of it. From a procedural perspective, there are assessments that get done during the training program. So being, observed doing biopsies, excisions, laser treatments, injections of medications like Botox and steroids and those kind of things. And the procedural side also gets examined from a Viva type of situation as well, with very numerous short cases. One thing that's a little bit different is that there is a little bit of laboratory dermatology that gets examined as well. So how to interpret microscopy, and then how to interpret histological examination, so slides, pathology slides. That's something that's pretty unique to dermatology. And throughout the training in every year, there's always observed clinical encounters that occur, and trainees keep a logbook of procedures that they do. Those are the main things that that kind of stood out for me.
Was there anything that you needed to add, Jeanette, or might have changed?
I think that's pretty much it. So across the 4 years, there is a logbook, and that's now done online. So that's for them to track what needs to be done. And then at the end of each year, it does need to be signed off by their supervisor of training for them to move on to their following year of training.
So it sounds like there's written assessments, lots of work-based assessments around the medical procedure and the lab work, the observed clinical skills, and then the Vivas and the logbook as well. Yeah, sounds fairly standard assessment types of assessments across a lot of the colleges, but obviously these are very specific to dermatology and quite intensive by the sounds of it. You'd say it was an intense training experience, but
it wasn't
really
intense.
passionate about it.
Yeah, well, I think it was intense, but it's certainly, I mean, it's that intensity that's really given me the skills to actually be able to function in a relatively independent, autonomous way up here. I think without it, I'd probably struggle. So it is a testament to, just how good the training program is. And the beautiful thing about the training program is also that it's so standardized across all of the different, training states. Like not every college is able to have one, set of examinations done at the same time at the end of the year. It does mean that, I really trust, all of the opinions and diagnoses of the interstate dermatologists when I'm referring, or if patients are coming from interstate. It's almost like we're taking over from yourself if you had referred the patient yourself. So yeah, it is quite great.
Yeah, and it sounds like the Darwin Dermatology Service has a really collegiate network, particularly with South Australia. and that's really valuable considering it's such a small service at the moment, with capacity to expand by the sounds of it. What professional development and like career progression opportunities do you get from the college and stuff after you've fellowed as well?
So, I mean, there are a variety of extra training that can be done. So, for example, there's Mohs surgery training, there's micrographic surgical training. It's possible to do get further experience in pediatric dermatology at a number of centres, occupational dermatology. The college now offers a cosmetic dermatology extra training as well. So there are a few streams, you know, afterwards that can be explored as well. Really, the college annual scientific meetings are fantastic. I mean, that's the time when everyone kind of gets together and we share all the research that's been happening from around the country. I mean, I think that's probably from an annual perspective, that's really refreshing to see. So yeah.
Yeah. Is there, that's really great. Sorry, I was just thinking about another question in terms of the entry pathways and applications. I do know that we've had a few Aboriginal and Torres Strait Islander doctors who've pursued a career and working towards fellowship with the college. Is there any particular pathways or anything that we might be able to let people know about in the Northern Territory, as since our NT medical program really prioritises the progression of Aboriginal and Torres Strait Islander medical students through to getting their graduate certificates? Yeah.
So, I mean, my understanding is that there is one position which is run out of, I'm pretty sure that's out of the Victorian faculty, which is more focused on Aboriginal and Torres Strait Islander candidates. Is that right, Janet?
We do have an Aboriginal Torres Strait Islander position, so applicants do still need to satisfy the selection criteria as per normal applicants, but the funding generally does follow the applicants, so they can still nominate which state they want to train in, and if they were successful, then that funding would follow the trainee.
Okay, great. Thank you very much. That's really good to hear that there's some dedicated pathways for improving equity of access to specialty training programs for Aboriginal and Torres Strait Islander doctors. We're getting close to the end of our webinar. Is there any final comments or remarks either of you would like to make to our potential viewers?
Or just to say that, you know, to reach out to us. We're a friendly bunch, and, you know, we're happy to discuss things. It's not, I know I've said a lot about, you know, needing to be very committed and that kind of thing if entering the training program. But I also know that, you know, if you're not sure, sometimes it's helpful just to have a chat about how it all works. So I do that quite a lot.
Great. Jeanette, anything from you?
Just to reiterate that applications do usually open in February for the following year's intake. So we do advertise in the national paper, and then we advertise on our website. But certainly if applicants are interested in applying and they want more information, then to contact the college or to contact myself, and we can see what we can do to assist them.
Great, wonderful. We'll make sure that those contact details come up on the webinar for future, but if anyone's interested in contacting us at the Flinders Regional Training Hub, I've just got our website details and email there, and if you want to contact Jeanette or Deb through us as well, we can certainly forward on your queries and questions and wanting to connect. We also have career pathway flowcharts for all of the different specialty colleges that are available on our website there. We do have a quick poll that I'll get one of my colleagues to start, because I don't seem to have the start the poll on my screen for some reason. So one of my colleagues will start that poll for you. It's just a few little questions for you to answer in regards to this webinar series. Thank you very much. They won't take very long. And while you're doing that, I'd like to formally thank Dr. Dev and Jeanette from the Australasian College of Dermatologists. It's been really lovely having you both on this evening, and we wish you all the best, Dev, with the growing of the Darwin Dermatology Department, both in the public and the private sector in the Northern Territory, and hopefully you'll get some very interested junior medical officers or students coming your way soon. And thank you very much, Jeanette. We really enjoyed hearing about all the entry pathways into and the application process for becoming a member of the college. Thank you very much. And I think we will end the evening there, and this will be available for viewing at a later date on the Flinders Regional Training Hub website. Thank you.